This is Impossible Pava, and today we are going to discuss more about obesity. So I have joined by a guest who will give us more insights about obesity. So I welcome you in this podcast.
Welcome.
And besides you to introduce yourself.
My name is Jairus Chopiga.
Okay. So let's talk about obesity. What is obesity?
Obesity, according to the way I hear in my head, obesity is a long-term healthy condition that progresses over a time.
Yes.
Yes, that's obesity. We can also define obesity in a way that obesity is a excess body fats that may impair health. That is the definition of obesity.
Okay. There are the most symptoms of obesity. What are they?
Yes, if you can say about the symptoms, there are no specific symptoms about the obesity, but a doctor may diagnose obesity based on following factor. Yes, excess amount of visceral fats that are higher than amount of body fat in other area.
Yeah.
Symptoms of obesity normally have two symptoms. First is excess amount of abdominal or visceral fats that are higher than amount of body fat in other area.
Yes.
Second one is a waist circumference of greater than 40 inches for men or 35 inches for women. Trusted source. This is the symptoms of obesity which I know.
Okay, so what is childhood obesity? Because I have heard about that.
By the way it sounds that childhood obesity, what I think is a obesity which normally occur or suffer only the child or children. That's why it say childhood obesity. So before I explain more, for a doctor to diagnose obesity in a child over a year or 10, their BML has to be at or above 95% trusted source.
Yes.
BLM at or above 95% is higher than BLM of 95% of people with a same age and sex assigned at a birth. So let me tell you the percentage of BLM on a child with obesity.
Yeah.
Yes. Less than 5% must be underweight. This is the first.
Yes.
Second one, 5% to greater than 85% must be normal weight. A third one is 85% to greater than 95% must be overweight.
Yeah.
95% or over must be obesity one. It means the child which have 95% or over is the one we call that child with obesity.
Okay.
And this is where I can answer.
Okay.
Yeah.
So what are the main causes of obesity?
If you can say about the causes, there are so many causes which you can say. Before I explain about the cause, there are some notes maybe which I can tell you to help to understand normally. Taking in more calories than you burn in a daily activity and exercise on long-term basis, so can lead to obesity.
Yeah.
Let me repeat the point because I speak it in a fast way. Taking in more calories than you burn in daily activity and exercise on long exercise basis, right?
Yeah.
Can lead to obesity. Over a time, these extra calories add up and cause weight gain. this thing which I have already explained, it makes people to gain weight, to be obesity one.
Yeah.
Yes, but it's not always about the calories in and calories out, or having sedentary lifestyle. But there are indeed causes of obesity.
Yeah.
Beside, except what I have explained, there are also mainly causes of what? Obesity. Let me tell you.
Causes.
Specific causes of obesity. So the first specific cause or many causes of obesity is genetic.
Okay, so how genetic cause obesity?
Okay. Thanks for asking me how the genetic affect the causes of obesity. I can explain that genetic can affect how your body process food into energy and how fat is stored.
Yes.
Only the genetic it affect in a way how the body process food into the energy and the what and how the fat is stored in a body.
Yes.
This is the way how the genetic causes the what? Obesity. The second one is growing orders.
Yes. So how is growing order affecting obesity?
In a growing order, I can say that growing order affect less muscles mass and the slower metabolic rate, and also the to gain weight. Yes. I want to repeat the growing orders.
Yes.
Maybe that way is so new to you, but it is growing orders. It affects the causes of what? Obesity in a way that it leads to less muscles mass and slower metabolic rate, and also it making it easier to gain what? Weight.
Okay.
Yes. The third one is not sleeping enough.
So how it is affecting obesity?
Not sleeping enough, it affects obesity in a way that it leads to hormones change that make you feel hungry and crave certain higher calories food. Yes. If someone not sleeping enough for a minute,
yes.
There's some books it explain that it makes people to have appetite of food as it's just they eat with no range. They eat more food, normally fast ones.
Of course, my Form 4 teacher told me that it is good for a person to sleep 8 hours.
Yes. The recommended time for sleep is 8 hours. Yes. But if you can sleep at night, maybe at 2 hours,
yes,
it also makes someone to suffer from what?
Obesity.
Okay. Yes. Let me proceed.
Yeah.
The fourth one is high stress. Maybe you can ask, how stress affect how stress causes the what? Obesity. Stress may also trigger the what? Production of hormones that cause you to eat more and store more fats.
Okay.
Yes. The fifth one is a pregnancy.
How it is affect?
Pregnancy, as a weight gained during the pregnancy, may be difficult to lose and might eventually lead to obesity.
Okay.
Yes. I remember what I did at the primary. That statement is true.
Is it true?
Is it true?
Okay.
Because I have a reference at my primary exercise book.
Yeah.
Yes.
Okay.
There are also, except when I have explained about the specific causes of what? Of obesity. There are also certain health condition that also can help to weight gain. Yes. In other way, there are also health condition that cause the what? Obesity. Only the health condition.
Yes.
Yeah. Let me talk about the health condition which causes the what? Obesity. The first one is metabolic syndrome. Metabolic syndrome is one of the health condition which can cause the what? Obesity. Maybe you can ask how it affect, how it cause. A group of risk factor that include high blood pressure, high blood sugar, high level of triglyceride, low level of HDL, cholesterol, and so many things. Addition to excess fat around your waist that leads your change of developing certain serious heavy condition. This is where I can explain that the metabolic syndrome is the bladder wheel syndrome.
So how it is affect?
Bladder syndrome, it affects in a way a condition present at a birth that causes excess hunger. During the birth or during the delivery for the woman, after the delivery or after the birth, the most woman have the appetite to eat because they lose so many blood, so they want to eat what? The food. At a time, if they eat more food, there's some book just write that they can also cause the what? Obesity. Yes.
Okay.
Third one is the Cushing syndrome. A Cushing syndrome, it affects in a way that a condition caused by what? Having high level of cortisols. Maybe you can aware from the word cortisols. So that is the stress hormones. In a body we have most hormones, but one of is a stress hormones in your system. The respiratory health condition which causes the what? Obesity is a underactive thyroid. Underactive thyroid. It affects in a way. It's a condition in which the thyroid glands does not produce enough certain important hormones. If a body fail to produce that hormones, the people are likely to suffer from what? Obesity. Yes, this is what I know about the causes of what? Obesity.
You have well explained about the causes of obesity.
Yes.
So, who is at risk of getting obesity?
Okay. But the sort of the at the risk of obesity, I can say that I can start with a complex mix of factors that increase the what? Personal risk of obesity. There are so many things which can make someone to suffer from what? Obesity. But also there are specific people that are very, very, very dangerous on risk of what? Obesity. The first one is a genetic. Genetic is a first one risk on what? Obesity. Some people have genes that make it more likely for them to gain weight and what? Body fats. So the genetic is one of the risk on genetic. The second one is the environment and the community. Maybe you can ask how the community affect the one obesity. Environment and the community can affect the risk on obesity in a way that your environment or my environment at a home, even or at a school, even at your community, all in all can influence how and what to eat, as well as how to achieve to. Yes. And this is how I can explain about the risk of obesity, that they are genetic first, second is environment and the community.
Okay, so what are the medications of obesity?
Medication of the obesity, we can say that medication can also rise your risk of weight gain. This medication include there are three medication which I know, which I can tell you. The first one is antidepressant. Antidepressant. The first one. The second one is the antithyrotic. By that way is always it makes it difficult to pronounce it, but I think you know what I mean. The third one is beta blockers. On the beta blockers, I can say it may treat higher blood pressure. Yes, this is where I can explain about the mitigation of obesity. Yeah.
Okay, let's proceed. How obesity is diagnosed?
Okay. The obesity is I can say that obesity is diagnosed by the doctor because there's someone who cannot do obesity person. You cannot diagnose obesity person.
Yeah.
Before I explain more according to that question, I explained that BMI provide the rough calculation of person weight in relation to their height. In a hospital, there is a BMI, which is rough calculation, which have calculation of person weight according to their what height. It means the height of person, it indicates the what weight of person. So in other way, the more accurate measure of body fat and where fat body is located include I want to tell you where the normal parts, where the fat in a body they are sticked. The first part is skin for the thickness test. The second one, waist to hip comparison. The third one is due energy radiographic absorptiometry. In other way, we can say DESA. DESA scan. So there are screening tests which we can use. There are screening tests which we can use to test a person who suffer from what? Obesity. The first test is the ultrasound. The second test is the CT scans. The third test is MRI scans. So doctor may also order the test to help to what? Diagnose obesity relation health risk. So maybe you can ask why the doctor use that test to people who suffer from what? Obesity. The good reason, the good important is it help to diagnose obesity related to health risk. Yes. This may include blood test to examine cholesterol and glucose level, liver function test, diabetes screening, thyroid test, heart test, and so many others. I think we have explained a lot about that question. Yes,
so
proceed.
What are the complications of obesity?
Complication is true in a world. People can be complicated with obesity. What is disease? What is disease? How it is? How we can cure it? But this question it goes straight on complication. Obesity can lead to more than weight gain. If you can say obesity is weight gain, to have a large body. Having a high ratio of body fat to muscles put strain on a body as well as internal organs. So it increases inflammation in a body, which may also put risk factor for cancer. It means if a person suffers from obesity, normal after a time, it also suffer from the cancer.
Because there is blood cancer and the other types of cancer. So he or she can suffer from all the types of cancer or some specific?
Some specific cancer, not all the cancer. Let me, I'll tell you as in that. Obesity is also a major risk factor for what? Type 2 diabetes. From the book it explained that heavy complication, there are some which can be life-threatening if not treated.
Yes.
So I already say about the type 2 diabetes. There are so disease which follows below the obesity.
Yeah.
If someone suffer from obesity, eventually they also suffer from the disease I want to tell you now. The first disease which that person can suffer is type 2 diabetes. The second one is a heart disease.
Yeah.
The third one is high blood pressure. The fourth one is a certain cancer. So there are so different type of cancer.
Yes.
Maybe normally breast cancer, colon cancer, and the ATC. So many.
Okay.
And the fourth one is a stroke. 5 gallbladder disease. Another 5 liver disease.
Which means if you suffer from obesity,
you are expected to offer all these diseases which I explain now.
Okay.
Yes.
So it is so danger.
It's so danger.
Okay. So how is obesity treated?
Obesity, there are so many ways which we can treat it. So because it's very what? Dangerous.
Yes. So dangerous.
We need to treat it first when you determine that this is obesity.
Yeah.
First, start with primary care physicians. Before you go to hospital, there are some primary care in the village which you can meet to help you.
Natural doctors.
Natural doctors. Or who may also refer to you for weight specific in your area. Doctor in your area want to work with you as part of what? Team helping you to lose weight. That doctor help you to lose weight.
Yes.
So that you can feel better from your what? Obesity. In addition,
yeah,
I can say that the team of doctor might include when you can meet with a doctor in a village to help you. Normally they what are primary care physicians.
Yeah.
Like dietitians, a therapist,
yes,
or other health center staff. Also, these people can help you to reduce the what? Obesity.
Okay.
This is the way I can explain about the what? Obesity treated.
Okay, so which lifestyle and the behavior changes can help with weight loss?
If you can say about the lifestyle and changes, which can help the person who suffer from obesity to weight loss. Before I answer, I need to give you some statement that health care team can also recommend you food choice and help develop nutrition eating plans that work with you. Yes. You need to choose the food. You need to choose the right food which you can eat. Not eat any food, because there are some food which can cause someone to undergo what? Obesity. Also, just to concentrate, eat the food which you can get light nutrients.
Yeah. What are the types of weight loss surgery?
If you can say weight loss surgery, there's so type. Before I go further, I need to tell you another name of weight loss surgery. That it bariatric surgery. If you hear somewhere, some people chatting just to hide the weight loss surgery is a bariatric surgery.
Okay.
So this type of surgery limit how food you can comfortably eat, or prevent your body from what? Absorbing food and calories. Yes. Sometimes it may do both. Even limit how much food you can comfortably eat, or prevent from food absorbing what? Food and calories.
Yeah.
before I losing time, I need to go further normally on type of weight loss surgery. The first type is gastric bypass surgery.
Yeah.
Gastric bypass surgery. Maybe you can ask how the gastric bypass surgery work.
Yes.
In a procedure, surgeons create a small pouch at a part of your stomach that connect directly to your small intestine.
Yeah.
It means the food and liquid go through the pouch and into the what? Intestine. Bypassing most of the stomach. This is where how I can explain about the gastric bypass surgery.
Okay.
Yeah. The third one is the laparoscopic adjustable gastric banding. Yes. In a short way, you can say the LAGB.
Yeah.
Yes. Which help to separate your stomach into two pouches using a band. Yes. The third one is the gastric sleeve surgery, which help you to remove the part of your body stomach.
Yeah.
Yes. The fourth one is the bilateral division with duodenal switch. It also same like how it work. It same like gastric sleeve surgery. It also explain that it help to remove the most of what your stomach. Yes. This is how I can explain about the type of body
Loss surgery.
type of weight loss surgery.
Okay. My last question. I want you to know, how can I prevent obesity?
To prevent the obesity is a simple way. As the person who suffer from obesity receive what recommended advice.
Yes.
Firstly, I can say that on a personal level, you can help prevent weight gain and obesity by. The first one is getting regular moderate exercise. I think this point I have already explained at a previous question, but this about it come on how we can prevent the what obesity. Yes. That are the obesity one must do regular what moderate exercise. Yes, also Abanga repeat. Okay. Maybe you can ask the types of or example of exercise which these people can do. Yes, it's simple. Like first one is walking, just walking. Walking is a exercise. The second one is what? Swimming. Yes. Or even jogging. Okay. Yes. Second point is eating balanced, healthy diet composed of nutrition food. Yeah. These people must eat food which have nutrition, not eat anymore, like fruits, vegetable, grains, even lean protein. That have more nutrients. Yes, that have more nutrients, not fat, but the nutrients. Yes. Fourth one is eating calories food and those have insaturated and trans fats in a moderation. This person must eat the food which have no oil, the food which is saturated. Yes, and in a moderation. Yeah. Yes, in a moderation. Okay. Also, the last point I can put in that question is obesity is a chronic medical condition which is always caused by excess visceral fats. Yeah. Yes. So it may raise you risk on developing multiple health condition, including heart disease and diabetes. This is a dangerous disease. Yeah. So if someone suffer from, they need to what? Go for hospital to receive treatment at first. Okay. This is what I know about the obesity.
Okay, so this is the mark of our discussion for today. So I thank you for giving me more insights so that the people they can well understand what is obesity, what causes complications, treatment, and how we can prevent.